starting Friday, Nebraska becomes the test case for Medicaid work requirements in America. So if you're between 19 and 64 and you've got coverage through Medicaid expansion, you got to clock 80 hours a month of work, school, or community service, or you lose your health care. And so this is essentially the test of what Trump's big, beautiful bill is going to roll out nationwide in 8 months. A move that has researchers projecting that between 5 and 10 million people are going to lose their Medicaid because of it. Right in Nebraska specifically, you had Governor Jim Pillen announcing back in December that his state would be the test case. And his framing was that he wanted to make sure that every able-bodied Nebraskan is part of their community.
We have over 100,000 job openings, jobs that can't be filled because we don't have enough people. So there's incredible opportunities for every person who is wanting Medicaid that is able-bodied to work. Most importantly, for our kids. It's really important for our kids to see people in their household working, fulfilling the American dream.
Now, really quick, I do want to flag something before we go further. Nebraska doesn't actually have a problem getting people to work. They actually have one of the lowest unemployment rates in the country. In February, it was 3.1%. So this isn't a state where huge numbers of able-bodied people are, just sitting home avoiding work. And so the able-bodied framing, it's doing a lot of the heavy lifting in this kind of political rhetoric.
This is a hand up, not a handout. I think it's also important for all of us how rewarding work is. It's a key piece of giving the discipline for our families to be successful. It's a key piece of self-worth. It's a key piece of mental health and stability.
And so that, I think it sounds nice to a lot of people, but also work requirements, they've been studied repeatedly, and the data, it's consistent. They do not actually increase employment. They just kick people off of Medicaid. And as far as how the system works, here's the mechanics. Nebraska first has to verify that the roughly 70,000 people already enrolled through expansion are still eligible, with about 20 to 28,000 of them having to provide more documentation to keep their coverage, and then another 3,000 to 4,000 of new enrollees each month, they're gonna need to do the same. And well, right now, people only have to prove that they met the work requirement for at least 1 month out of the last year. By 2027, they'll have to maintain that for at least 6 months to keep their benefits. So there's also some flexibility, right? People can show proof of making at least $580 a month instead of logging 80 hours. So that'll help people who work for themselves, like freelancers or hairdressers. But also, here's one of the issues. We have to wonder about whether that flexibility applies to specific situations because the rules just aren't clear yet. And that's just one of the problems. Right? States only got 18 months to roll this out, and you have healthcare officials warning that the speed alone, that's a problem. Or you have health policy experts saying the speed at which we are choosing to implement work requirements hasn't left a lot of space for really meaningful communication. And so you have real questions piling up, like do apprenticeships count as work? If someone regularly goes to the hospital for care, how far does the travel have to be for a medical exemption? And who checks? You've got people confused, and once you're asked to provide more information, you only have 30 days to comply. So then if you can't navigate the bureaucracy fast enough, you just lose your coverage entirely. And the administrative side doesn't look ready either. Medicaid employees are about to review tens of thousands of accounts under a new mandate that they didn't have time to prepare for. They do not appear to actually have the capacity to answer all of these questions in real time. And all of this is something that researchers have called administrative burden. And the data there is brutally consistent. Researchers say that the higher the administrative burden, the more likely people are found non-compliant and disenrolled. Or to put it in plain English, when you stress the system, a lot of people, they don't fail the work requirement, they fail the paperwork. Right? They miss a deadline, they can't get a question answered, they don't realize they needed to upload a document and they slip through the cracks. They lose their coverage not because they don't qualify, but because the system was designed in a way that they couldn't navigate. And in fact, we are already starting to see the consequences. You're seeing reports that are describing young parents who are going against advice from their own doctors to work, or because they can't afford to lose their coverage. And so you have people compromising their health to keep the very thing that's supposed to protect their health. And then there are also cases where Nebraska is using digital records to determine who keeps coverage, which means that doctor's notes or other personal documents that might not be in the digital system can result in people losing their coverage for completely unjust reasons. So Nebraska, they're supposed to get feedback from the federal government in June to help fix some of the issues. But then that just leaves a month where people's healthcare is hanging in the balance with no clear answers. And again, this goes further than Nebraska because whatever guidance Nebraska gets, it's going to be the template for other states and what they adopt when this rolls out. So if this isn't surprisingly figured out, if the issues aren't ironed out, this becomes a national problem affecting tens of millions of people. But with all this, you have many arguing that this is exactly what Trump wanted. Where you have an administration cutting social programs, finding ways to cut the most vulnerable Americans from programs like Medicaid while also spending massive amounts of money on the Iran war and on tax cuts that disproportionately benefit the wealthiest household. And understand with this specifically, the people who lose, they're the ones with the least margin to absorb loss, right? Single parents managing chronic conditions, people in unstable jobs, people who can't easily prove they qualify for an exemption, people without things like reliable internet access to upload digital records. And this will have real physical consequences. Untreated diabetes, missed cancer screenings, mental health treatment just gets dropped. People not filling their subscriptions. There is a real downstream cost here, both human and financial. So this is something that we're going to be watching closely because Friday is the start. But again, remember, 8 months from now, it goes national.